Hello, in this video, let us look at MUPIROCIN. Okay, MUPIROCIN sounds like crocin tablet. No, it is actually an antibiotic which comes in the form of this ointment, which is very famous TBACT ointment. So whenever you have some skin infection or anything, right, they ask you to apply this topically. But we never have read this in a proper classification of antibacterial or antibiotic. So how does it hurt the bacteria? It inhibits protein synthesis. So the protein synthesis, let me highlight that for you here. Inhibit protein synthesis is what MUPIROCIN does. So it's an antibiotic which inhibits protein synthesis for the bacteria. So bacteria cannot synthesize protein. So in the miscellaneous classification, we have MUPIROCIN. So you need to know this because you're prescribing it, isn't it? So what is MUPIROCIN? It is a topically used antibiotic. That is, you apply it topically, not inside, anywhere inside. You apply it on the skin, topical. And it is an antibiotic to kill the bacteria. And from where is it coming? It is coming from Pseudomonas. This is Pseudomonas shown here. It is a genus of gram-negative bacteria. So from that Pseudomonas, they are getting this antibiotic, but it is active. This MUPIROCIN will act against what bacteria? Gram-positive bacteria. So you should understand MUPIROCIN comes from gram-negative bacteria and is active against gram-positive bacteria like this one. This is what? Streptococcus pyogenes. Or streptococcus basically, and this one is staphylococcus. So it is active against streptococcus, staphylococcus, even MRSA, that is methicillin resistant staphylococcus, okay, bacteria. So MUPIROCIN, now you tell me, what are we talking about? MUPIROCIN. See, everybody will make videos for you which talks about the brand name, but we cannot do that. We are talking about examination here. So MUPIROCIN. MUPIROCIN is an antibiotic, miscellaneous. It is not coming under those big classifications like cephalosporins, penicillins, sulfonamides, or other things. So from where is it coming? It is coming from Pseudomonas bacteria, which is gram-negative. It is but this MUPIROCIN is active against which bacteria? Gram-positive bacteria. Example, Streptococcus, Staphylococcus. Okay. So MUPIROCIN is derived from Pseudomonas, which is a gram-negative bacteria. But MUPIROCIN will act against gram-positive bacteria like Streptococcus and Staphylococcus, even MRSA, if it is resistant to methicillin. So methicillin resistant Staphylococcus aureus bacteria, it is resistant even against, it will act even against that. Okay, so MUPIROCIN is this much we covered. So it is active against gram-positive. This also we covered. How will it act against the bacteria? It will not allow the bacteria to synthesize protein. Okay. That much if you know, it's enough. But if you want to know more, it blocks the production of tRNA for isoleucine. So this is the amino acid which this MUPIROCIN is something it is doing. Okay, you need to read that. tRNA is transfer RNA, isoleucine is amino acid. Oh, that's all we know, isn't it? Something it is doing to block the production of protein by the bacteria. Okay. Which bacteria? Gram-positive bacteria cannot make the protein. Look at this classification again. So you need to understand that the antibacterial drugs do so many ways of attacking the bacteria. Ours is here inhibit protein synthesis, just like our tetracycline, like doxycycline, etc. Okay, but this one is what? MUPIROCIN, you supply topically, remember. Okay. Now, do you know other famous antibiotics that you give? Penicillin, cephalosporin, streptomycin, rifampicin, antitubercular, then sulfonamides, then metronidazole, ciprofloxacin, fluoroquinolone, amphotericin B. So there are many ways of killing bacteria. Okay, and where does our drug sit? We have added it here because Mr. K.D. Tripathi did not add it for us. Okay. Now, so what does this contain? TBACT ointment, MUPIROCIN, 2%. Okay. It says. So basically, what does it do? It makes bacteriostatic. It doesn't kill the bacteria. The bacteria just halt. They cannot proceed. They cannot reproduce. So basically, bacteriostatic. but they're saying if you apply lots, then it will become bactericidal. It can become bactericidal. That means it can kill the bacteria also. When will you apply this? You will apply furunculosis. Furunculosis means what? Furuncle. Something to do with the hair follicle. Okay, folliculitis. Same thing, follicle, I think. Right? Impetigo, some skin boils, bacterial infection. Infected insect bite. If insect comes and bites you and it gets infected, they want to kill the bacteria, remember. Small wounds. Could be even, I have seen because of burns, if they have to prevent any bacterial infection, they are applying TBACT, okay? But that's not written in the textbook that you have to give it for burns. So, what and all are the side effects? Local itching, irritation, redness may occur. Interesting. And you get in this form, TBACT or Bactroban, they are saying 2%. You can apply 3 times daily, but apply it on clean skin and first clean the skin and then apply. And then don't touch the tip of this ointment, what am I saying, tube. Should not touch the tube at all. You should just take the ointment and make sure that it doesn't get contaminated inside. So in fact, they're saying you should not use it more than 10 days. Okay. Not the textbook, but otherwise. And also they are saying don't apply too much. You will have that irritation side effect, etc. So do not use more than 10 days. Do not use too much because it will too much quantity, because it can cause side effects like that, they are saying. And it is for external use. Avoid eyes, nose, mouth, etc. If it gets in contact with those, you wash it off. And you can use it in pregnancy, they are saying. Okay. So do not use more than 10 days. We already told you. Okay. So we are done with this MUPIROCIN. It is a miscellaneous antibiotic. It works by stopping the inhibiting the protein synthesis by the bacteria. Okay, so it is mostly bacteriostatic is what the textbook says. So we'll go with that. It is active against what? Streptococcus, staphylococcus, gram-positive bacteria. This much you should know. Okay.